My name is Mark Conley, and I'm a physical therapist by profession, and I'm also the manager of Parkwest Therapy Center. The thing I enjoy the most about my job is my interactions with people, both the people that I work alongside and the patients that I treat. I've always been very, very happy to interact with people, and I get a good feeling, as cheesy as it sounds, helping somebody have a better day. And when people come to me, they're having real problems. It's not just like they blew a tire, but they blew a joint. And that really affects quality of life. And if you can play a vital role in that person's life and make them better, and they come to you and say, hey, look what I'm doing now. I mean, there's no better feeling as far as I'm concerned. It's working alongside the people that I work alongside. The most consistent feedback we get from patients who have been with us and assess us afterwards in their experience is that they seem to always say something about the camaraderie and the fellowship that we have as co-workers at Parkwest Therapy Center. Most of us have been there a long time, and we've been there a long time because we like working there and we like working together. It's a place where people support each other, they help each other, they see when someone's in need, and they help out without being asked. And that's golden, and that's something I want to be a part of and have been a part of for a long time. Well, they say sometimes it's good to be on both sides of the healthcare coin, I guess, both as a patient and as a practitioner. And I started out as a patient. And I was 17 years old. I had a little run-in with lung cancer and had to spend a little time in a hospital. And during that time, I was severely impaired as a result of the length of my procedure. I had one side of my body that was not functioning well. I had some muscle damage in my my right leg. And I couldn't walk for a couple of weeks. I had some other issues that were holding me back, but I'll never forget the pain that I had when I was walking. And so I had some people work with me and get me walking again. And I thought, this is not a bad thing. It really helped me a lot. It got me back to school and eventually back to as normal a life as I could have. And so as I got into my college years, and I started exploring what I wanted to do, I started out with a pursuit of biology and marine biology. And then 2 years into my education, the school where I attended, North Georgia University, started a physical therapy program, and I investigated it and really, really liked it. And I started doing some volunteer work at the local hospital there in Gainesville, Georgia. And in the physical therapy department, I just felt at home, and I was so intrigued and motivated and inspired by what I saw. I knew that was what I had to do. And so I got lucky and I got into PT school, and then graduated and wound up taking a job here at Parkwest Medical Center in 1998. And I have been there ever since. It's the only job I've had outside of school, and the only job I've ever wanted to have. Number one, it's just the right thing to do. As simple as that sounds. I mean, we all know that's what the right thing to do is, no matter what kind of business you're in. You always put your customer first if you want to be in business. But what I think moves me more than just that idea is having been a patient going in to visit a doctor's office and not really having a great experience. And it's not a good feeling when you go in there and you have a real problem and a real concern. And the person that you're interacting with, you can really see that you're not really their priority at that moment. They may be looking at their phone, they may be, not giving you good eye contact, not being an obvious interested listener. Mm-hmm. And that's not a good feeling. It's something I never want a patient of mine to walk away from their experience with me thinking was what they got out of it. And so when I'm with a patient, I forget the world around me. They have my undivided attention for the period of time that they're there. They actually get a lot of my attention when they're not there, because I have to think about what I want to do with this patient to get them better. But when I'm there, I'm locked in. I give them eye contact. I give them my ears. I give them my empathy, because people are hurting. And part of treating a person is not just treating their physical injuries, but listening to them as they express their emotional injuries that go with it. And I'm not a psychiatrist or a counselor, but you can help a person a lot just by being an effective listener. And I think that's part of giving somebody quality care. Well, I'd like to give my parents quite a bit of credit for that, because it's really how I was raised, and it's what I saw in my parents. My father being a minister, he had his congregation, and he strove to minister to them and to take care of them, no matter what their problems were, and put them first. And that's quality. That's excellence. That's putting someone else ahead of you. And I think if you put others ahead of yourself, your patients, your coworkers, good things are going to come to you. If nothing else, a really good feeling about what you're doing. So for me, that's enough to strive for excellence. I think that the community should choose Covenant Health first, because it's obvious that Covenant's mission is to enhance the quality of life of our community. Excellence through better health. You see Covenant's presence all around. An example, the Covenant Health Knoxville Marathon. That's a very big event with a lot of people that participate, and a lot of people who have really dedicated themselves to better health and to getting in shape to achieve or accomplish an event like that. The Biggest Loser program, the Biggest Winner program, they're all tied into that. They're all Covenant supported events. That's something I want to be a part of. I've been a volunteer or a participant in the marathon every year that it's been in existence, and I'm very proud of that.